We are back with Dr. Lisa, my old roommate from chiropractic school. We graduated in 2007, so always a little bit ago. And we both, if you haven't ever been to a chiropractor before, there's tons of different techniques out there, and you're going to have a vastly different experience from going one place versus another. So just want to keep that in mind. If you had not a great experience, it might not be a technique that works well with you. And lots of chiropractors have like a lot of tools in their toolbox for types of techniques. We've taken a ton of continuing ed together after we graduated, and when we were in school, even we took continuing ed in school because
don't stop learning.
Yeah, who doesn't need to keep learning additional stuff when you're already swamped with work? But there's definitely been a shift in, how we practiced right out of school till now, and we're still very musculoskeletal and trying to look more at the whole body rather than just the adjustment, the cracking part of chiropractic, because, I feel like there's a lot more to it. And as we get even further, like the mind-body connection, the yoga or meditation, there's all these different components that go into helping you get the most optimal health for yourself. But her technique that she taught me little snippets of it to use as another little tool in my toolbox. So you might have had it in the office and just didn't know what you were getting. She worked under I'll let her explain it, but her technique that she uses a lot of in her practice is a trigger point technique.
So the trigger point technique that I use is called officially, it's called the receptor tonus technique. It was developed by a chiropractor named Raymond NIMMO back in the 1950s, where it was unheard of to do any type of myofascial or muscle work. At that time, it was adjustment or nothing. Bones pushing on a nerve, adjust. And he's like, well, that's weird. Here we have somebody doing only upper cervical stuff, and here we have only somebody doing sacral stuff, and the patient's getting better. What's happening? So he started looking more into kind of the central nervous system as the key components of kind of dysfunction and pain and things like that. And if it was just one thing pushing on a nerve in your sacrum, why would an upper cervical adjustment help your sciatic nerve, right? So he developed this technique called the receptor tonus technique, and for short, we name it NIMMO now after him. And then he taught my chiropractic mentor, Jeffrey Cohen, as Jeffrey Cohen was teaching at me and Kate's chiropractic school at New York Chiropractic College. And then I got to start teaching the technique. So I got to teach lots of students over 10 years, this really phenomenal and very easy therapy that's incredibly easy and very simple. And sometimes those are the best things, right? Mm-hmm. Sometimes the more complicated something gets, I don't know, it's almost too complicated then. Sometimes the easiest stuff is actually best. So from that technique, a lot of people, we're all familiar with active release technique and a lot of other things. So I would say that this is kind of the grandfather technique, and NIMMO has actually taught a lot of those developers and chiropractors of all these other techniques as well too. So we forget about NIMMO, but a lot of these other ones are a lot more popular now.
Yeah. And we actually took active release technique together, all the modules in chiropractic school, which it's funny because when you're in school and you come out with a technique that you're going to do, you do it textbook, and then you're out and you take all these other things and you kind of meld them all together to make what works best for you or for that specific patient. Because I know I use different techniques on different patients because they're not all the same.
Exactly. And that's the beauty of chiropractic too, is just we learn these techniques because they have been kind of trademarked, right? But they're all just tools, and we all turn them into this beautiful technique that is now Dr. Eckert's technique or Dr. Lisa's technique, right? So it's yes, I'm still a technician that primarily does NIMMO technique, but I have really kind of transmuted that into a lot of my things that have like changed my own life and things that I see have changed a lot of patients' lives. I mean, we've been practicing now for like 13 years or so. So that's thousands. Kate and I have touched thousands of people. We have worked on thousands and thousands of patients at this point. So that's a lot of research, and you start to kind of develop your own style of applying these tools in very specific ways. And I think there's a lot of beauty and creativity when that happens.
Definitely. And when we were in school, we both took the Graston technique, which is a type of myofascial work technique, but with a tool. And when we were in school, I feel like they kind of taught us harder is better, and we scraped the crap out of each other and bruises and all these things. And then we went and together took so the Graston tools are very expensive. I would never buy the Graston tools, but we went together and did another very similar technique in the thought process that it's a tool, but it's through rock tape, and they're called rock blades. And when we went, I was like, this is so much different in the concept behind it, because when we first learned Graston, it was like
scrape it all out, break out those adhesions.
We're gonna break this apart. But after being out of school for 13 years, we've come to find, and it's become more widely accepted, that we're not breaking things apart. We're creating changes in the nervous system, which ties in perfectly with chiropractic, because that's
what we're doing,
what we're trying to address. And we had to like rein ourselves in from more is not better, harder is not better. And I mean, I think the patients like it because it's not quite as painful, but some people I feel like still want you to like drop an elbow into their rear end.
And sometimes that's appropriate, but a lot of times it's not, right? So, but I just really appreciate that all of these new modern techniques are starting to embrace the facts that like we are working with the nervous system, and it's literally what NIMMO had said in the 1950s. Like he was saying this like way back when. So it's just nice to see newer techniques start adapting, right? And changing their language a little bit about like what we're doing and how we're doing it. But when you're first doing it, you just don't know always, we don't have the research to support what exactly we're doing. So it's all kind of like hypothetical. And a lot of people's hypotheticals are always very different. And then we do research, and then there is technology that will then kind of show what we're actually doing. And then we can kind of adapt our language accordingly to make it more appropriate for explaining what we're actually doing. So, but it's really a simple concept. And NIMMO was too. Like this trigger point therapy that I do is I find a trigger point or a knot or a source of an area where there's inflammation in the muscle, and I hold it for 5 to 7 seconds. And that's it. Like that's literally it. But the art of it is knowing where all to treat. So if somebody has like wrist pain, I'm not just going to treat their wrist. I'm going to be treating everything from like their neck to the inside of their shoulder blade to the rotator cuff. And he was teaching us all of this back then. It's just like, we have to find all of these kind of areas of like inflammation and treat them. And it really doesn't matter which one came first or which one came second. Like it's like the chicken or the egg. Like the goal is to treat it all, because you're never going to know exactly like which trigger point came first. Like nobody's ever going to actually know which trigger point came first or which one was secondary. Like, so just treat them all and don't worry about it. But treat the body as an entire unit, because everything affects our central nervous system that goes straight to the brain, and then it changes our sensory input, and therefore it changes our motor output again too. So everything is change in, change out. Very simple. Anything more than that is too complicated. So that goes for like chiropractic adjustments. We're changing input in. That goes for trigger point therapy. That goes for our diet. That goes for anything across the board. When you change what you're bringing in, you have a change going back out again.
Yeah. And the treating the whole body, if somebody comes in with plantar fasciitis and you just treat the sole of the foot, you're missing the boat.
Yeah,
definitely. And it could be all the way up to your forward head posture is causing you to shift your weight forward. So you shouldn't look at us like we're crazy when we try to treat your neck for your foot.
Yeah.
But
we're crazy for other reasons. That's not one of them.
Yeah. And insurance doesn't always love to see that you have treated someone's neck and shoulders for their foot problem, which is why Dr. Lisa doesn't take insurance.
I don't play their games anymore.
But I think that having that whole approach, like Dr. NIMMO, was kind of revolutionary.
Right.
In, you got like the Ida Rolf and that from those era. They were ahead of the game, and they, without much research behind it, were able to see ahead. And it's kind of almost like when you think back to yoga or meditation with the breathing. They knew that breathing was affecting your nervous system in a profound way. And then as we dissect and learn more about the nervous system, we see that the vagus nerves run through your diaphragm. So, it does physiologically work in a very specific way to downregulate our nervous system. How the heck did they know that or tap into that? And how conscious did they have to be of the body to hone in on that? Is pretty impressive.
And I think a lot of that is just repeated firsthand experience, right? A lot of times we don't always know why we're doing the things that we are, and our body has an innate ability to want to take care of itself. And so, thousands of years to control your heart rate with like breathing, or to control your body temperature with breathing, or control like your anxiety with breathing. And now finally our science and our technology has finally been able to catch up to like show, with actual data, and people love data and people love numbers, what our firsthand experience has been showing us for millennia. And I always find that very entertaining, is because we're so reliant on what technology can prove and what research can prove. Meanwhile, thousands of years have been showing us firsthand, yes, what you're doing works. Keep doing that. And we're like, oh, that's not valid. I know I experienced it, but that's not valid. I need the research to prove it first. And I think that's, it's fun now to just put some validation behind your firsthand experience. And then maybe later you come across some content or context where you're like, oh, that explains this. But like, trust your experiences.
Definitely. And I would say our experiences in treating people has drastically changed how we treat patients over this past decade plus.
Especially over the last 2 years.
So, if you have came to see either one of us 10 years ago, just know that when you come back in, you are not going to get the same experience, and you might be disappointed at first, but you need to be open to the fact that, we're constantly tweaking things as we learn more, and, not just learn on patients, but learn and go to different continuing ed and that kind of thing, and trying to fuse them all together. And maybe not even from what would stereotypically be thought as our realm. Like we've been to all the rock tape courses and those kind of things, but her meditation, my yoga practice, and that's might not be for everyone, and you might not even know we're infusing that into it, to what you're getting, but that is because all these different facets of life are going to affect your health. And if we don't, it's that domino effect. If you let your wrist pain go on, you're going to alter how your arm moves, and you're going to then hold your upper back in a different way. And then maybe you end up with headaches because you have let it snowball. And where did it start? Where is it coming from?
Or maybe it affected your breathing because all of a sudden your, anterior, like the front of your neck or your ribs are affected. And then all of a sudden, because you can't breathe anymore, you start getting anxiety, right? And now we have like a huge mental component of something that just started as like a possibly like a wrist injury. And the more anxious you get, the more you're like, oh my gosh, I'm anxious. Do you get like chest pain then? Or like, how does that snowball, and how does it start affecting like the rest of your life then, and your relationships and like your work? Because there's a whole bigger community. There's a whole bigger component to it. Also, Kate and I have evolved a lot over 10 years. So of course, the way that we take care of like patients is also going to evolve. And that's actually really wonderful. You don't always want to be treated this exact same way that you were treated like 10 years ago, like we're all changing, and all these courses that we're taking are continuing to just fine tune like what we do and our life experiences, like change how we're talking to you and how we're communicating with you. And it all becomes a lot more like authentic. And then we get into an even deeper sense of healing than just being phenomenal technicians.
Mm-hmm. Yeah. And
because we are phenomenal technicians.
And I also I don't want you to think that newer is always better, just like what Dr. Lisa was saying about NIMMO and being that, that's really old in comparison to some of these newer techniques. I learned a skin rolling thing from a chiropractor I worked with when I was first out of school, and I asked him, why do we do this? And he's like, I don't know, it works really well. And I was like, oh, okay. So, and I got away from it for a little bit, and then I went back to it.
I just came back to it again too. Just this week I came back to it.
and then I randomly saw a post by the Movement Rev, who's in the Maestro Mafia with me, and she explained the Batson's plexus, which is the vasculature around that area and how it helps vascularize around the spine and the discs and everything. I was like, oh my gosh, that old guy didn't even know what exactly the physiology behind it, but it is profound in how the patient. So when I start rolling along your your spinous processes in your back, it's it definitely has there's a physiologic reason now, and that's not just because this kind old doctor that was a wizard with adjusting told me about it.
He was a wizard with adjusting, and he was doing what he knew work from firsthand experience. And again, just because somebody can't always explain exactly why they're doing and why it works, maybe because it hasn't been figured out yet, that doesn't mean it doesn't work or that it's not valid. Again, if they've seen thousands of people and this happens to work, do we always need a reason? Do we always actually need a reason to have why things work? No. I mean, let some things be a little mysterious for a while, and then we can always find out later. But yeah. And the other thing is too, and I've talked about this a lot of times too, is just things that are popular. Everything is a trend sometimes too. There's a lot of trends, and definitely learn new techniques, definitely by all means, start to evolve and fine tune your things. But just because something's on trend, that doesn't mean that that's the only thing that works. Some things are definitely very tried and true, and they are very sustainable, and they are still very relevant in today's chiropractic community and treatment community as well too. And we don't want to forget about these, some of these older techniques that clearly are still very, very appropriate in a lot of ways as well too.
And just how every person is super individual. That's why she and I like to have a lot of different options or even different ways to introduce the same technique, because my 45-year-old patient that has fibromyalgia is going to respond a lot differently than an 18-year-old football player. And we want to be able to, and it might take some trial and error at first, is somebody going to respond negatively to a lot of pressure? We find that out. We dial it back. We try something else.
It's all research. We're doing our own research. Costs a lot less than technical research.
And actually, Dr. Lisa was involved in research with NIMMO. How that was a while ago.
That was a while ago, but we had the opportunity to work with New York Chiropractic College to actually measure tissue tension pre and post NIMMO therapy. So we measure tissue tension in a hypertonic or tight muscle before treatment, and then we treated only that muscle, and then we measured the tissue tension again, and then we treated full body and then measured the tissue tension again. And so we finally had some scientific evidence that NIMMO actually does work, and that treating the whole body actually decreases the tissue tension more than just treating the area of pain or symptoms or tightness, because it is a whole nervous system, and it is a whole body correlation.
Yeah, definitely. And so from the patient perspective, when, you'll be sometimes I get patients that'll say, oh, that's not where it hurts, but just let us treat the part that you think doesn't hurt, because we might feel tissue tension in an area that you don't have symptoms with or you don't have pain with. But tissue tension that we feel is still important to treat even if it's not symptomatic to you.
Right. Because it's still creating biomechanical changes in your body that aren't necessarily very efficient either, which ends up leading to more and more like compensation patterns, which ends up leading to more like tissue tension in other areas. And then all of a sudden you're biomechanically moving even less efficiently. And then you end up having a whole slew of problems where, you know, something could have been prevented if we just would have treated the whole body at the very beginning.
Definitely.
So.
And Dr. Lisa's model is different because she doesn't deal with insurance. So she sees so for my practice, it's insurance based, and insurance doesn't cover maintenance care, but Dr. Lisa does get to treat people and in that realm. And so she's actively preventing problems. So I give you the exercises to do at home so that you don't have to come back because, you know, insurance won't pay for it, but she gets to treat people and help prevent their injuries because you treat a lot of people that have a lot of hobbies that don't want to. And what would a maintenance appointment look like for someone that comes in and doesn't have a ton of pain?
But so I treat only 2 people per hour. So I do spend 25 minutes hands-on with you. So no electric stim or heat or anything like that. Like that's all you and me time. And most of my patients, I actually can't accommodate right now acute care patients. So if somebody needs to come in 3 times a week, they're going to be seeing my associate primarily and me to accommodate that. Most of my patients come in every 2 weeks or once a month. So depending on their activity level, I have a lot of people who are incredibly active, very physical jobs, and very athletic. In addition to having very sedentary jobs. So you go from being very sedentary 8 to 10 hours a day to being like super hyperactive. And there's clearly an imbalance there as well too. We would preferably like to be up and moving all day long instead of like trying to crank it all in an hour very intensely, you know, and here we get into the intensity thing that not always more is better. So you would come in and you would tell me your kind of chief complaints. Let's say if you have like neck pain, I'm still going to be treating from your hips upwards. Like I'll be primarily focusing most of my time on like your neck and shoulders and like jaw area. But I will be working all the way into your hips. And then as you come in, you're like, oh, this is better. But I also notice this now because you're always feeling the most acute, intense pain first. So you're a lot of times not necessarily feeling a lot of your other symptoms that you have in your body until your acute pain starts to subside. So I'm sure you've all experienced that where you're like, oh, I have chronic low back pain. And then you like, you know, have like a neck spasm. You're like, oh, my back pain's gone. It's not gone. Like it didn't just magically disappear because all of a sudden you have neck pain. No, like your brain is so on override with the intensity of your neck pain. That's all that it can focus on right now. So the low back pain all of a sudden became irrelevant. Once we get the neck pain under control, the low back pain doesn't just reappear out of nowhere. Like it's been there the whole time. It was just kind of like nudged to the side for a little while. So I like to just treat kind of generally the whole body on like most people. So for neck pain, I go hips up, and then follow-up treatments. I will continue to kind of like adapt more and more to like what you're experiencing.
So that is a good way to keep doing the things that you love and not having an injury, because once you have an injury, you usually have to step back from what you love doing and take the time to rehab that injury, which always takes longer than prevention, which for anybody. And
it's more expensive. Prevention, one, it feels good, right? You're getting taken care of. And 2, it's a lot more affordable when you're not getting hurt in the first place.
And especially if it takes you out of your job.
Too. Well, then it's really expensive. Especially when you're sole providers and like you run your own business. If we don't go to work, we don't get paid. And that's the other thing about like physical therapy and insurance as well too, is just like if you have like neck pain and like wrist pain, you need 2 different scripts, which means you can't get your neck and like wrist treated in the same appointments. So you might be going to PT like 4 times a week, twice a week for your neck and twice a week for your wrist. Whereas like if you see Kate and I, like we get to treat your whole body in one visit. We don't need scripts, you know, from somebody telling us like where we're limited on treating. And also it doesn't make sense because clearly your wrist pain, your neck pain are very much related to one another, completely tied in with one another.
And that's an insurance problem, because there are PTs out there that treat like Lisa and do cash only for the same reason that she does it, is so that they can have total
free
reign to treat how they're meant to treat and treat the most effective way. So
we're not, when you have the opportunity to work for yourself, you're not limited by anybody kind of like telling you what you can and can't do in a certain amount of time. Like I get to do what I feel as a doctor is best for my patient. And isn't that why I went to school? Like, I don't need somebody else telling me like, oh, no, you can't give your patient extra care today because it's not going to be covered. I'm like, that's wild. Mm-hmm. So,
yeah. And before we filmed this, I was telling Dr. Lisa about, I won't name it, but a big insurance company that's local to us that has this new way of monitoring how I treat patients, and I treat a lot of pregnant and postpartum patients. So they flagged some of my pregnant patients and said, oh, this looks like a chronic condition, which they don't cover chronic conditions. They said, actually, no, it's not a chronic condition. They're going to give birth here in 9 months and then they'll be released. No, but they really are pulling in the reins on us on how you can treat, and just the fact that they flagged my pregnant patients for being a chronic condition, which is ridiculous.
It's ridiculous. And it's really frustrating for us because we want to provide you the best care possible. And it should be incredibly frustrating to you because like you're paying for this insurance. Like, I mean, in this pregnancy case, I mean, that's wild that like the insurance that you're paying for isn't going to cover for you to get the best care possible because they don't know when babies are born. Like, I'm so confused. Mm-hmm. It's really frustrating.
Yeah, definitely. So, but
that's it. We're going to keep evolving as chiropractors, and you're going to keep getting better and better care.
Yes, that's right. Exactly. And so if you're one of my patients listening, you probably had NIMMO. You just didn't know because I don't usually tell people the techniques that I'm using on them, unless it's the tool and they're like, oh my God, what is that giant metal tool you coming at me with? But
there's lots of subtle things that Kate and I do that is very healing. It's very good for you. And we're not always telling you what subtle things that we're doing, but it's okay. It's okay.
Yes. But if you have any questions about NIMMO, you can ask me. And if I can't get the answer for you, I'll provide Dr. Lisa's stuff and you can check her out.
Awesome. Thank you.